It was a bit of a love-in last hour for the country's finance ministers. They've just wrapped up a day of meetings with their federal counterpart, François-Philippe Champagne. They may be facing deficits at home, but they seem determined to present a united front. With growing instability and uncertainty, including south of the border, that unity may be tested. The CBC's JP Tasker is on the story. He joins us now live from Ottawa. So JP, the minister gave an update on the Gordie Howe Bridge that links Windsor, Ontario and Detroit, Michigan. What do we know about how the tolls will be split with the Americans?
Yeah, there's a disagreement between the Canadians and the Americans on the toll revenue. You will recall that Canada financed the construction of the Gordie Howe Bridge, and the original arrangement was that Canada would keep all of the toll revenue until it was made whole for the cost of bankrolling this new cross-border artery between Windsor and Detroit. Well, after U.S. President Donald Trump got involved, threw his weight around and threatened to block the bridge from opening, the formula was reworked, and Canada will now split the profits with the U.S. Well, Finance Minister François-Philippe Champagne said today that Canada will share only the net profits. So this isn't, expected to be all that much to start because there's a significant debt load to pay off before any profit is realized. When they're collecting those tolls, so much of that revenue is going to go to pay off the debt, and half of nothing is nothing. But here's where there's a wrinkle, Andrew. Here's where Champagne's explanation differs from what the Americans are saying. The Trump administration says that they're entitled to more than the net profits, an official telling Bloomberg this afternoon that neither the loan interest nor the depreciation on these loans will be included. So they should get more money starting right away. So there seems to be a bit of different definitions floating around as to how much Canada is willing to give up to the Americans to finance this bridge, to keep them happy and get it open. Regardless, though, Champagne's saying that the concessions that Canada made were worth it. The bridge is going to open. Have a listen.
Bottom line, the bridge is going to be open. Bottom line, you'll see trade facilitated between Canada and the United States. This is a key piece of infrastructure to facilitate trade. You think about, what we have on the auto sector and the kind of exports we have between Canada and the United States. We have achieved an outcome that allow the bridge to be open. And also, I think that through negotiation, this is an outcome that's going to serve both countries.
So while there's this discrepancy over who gets what and how much and when, it doesn't appear, at least at this juncture, Andrew, to be jeopardizing the bridge planned opening. Still going ahead July 27th. The Windsor Bridge Authority just sent out an email about an hour ago saying plan to be there on July 27th. The same toll rates are still going to apply. Of course, a lot can change between now and then when Trump's involved.
Absolutely. We've been shown that day in, day out. There was some progress on internal trade barriers at the finance ministers' meeting. Tell us about that.
Yeah, so the feds and the provinces, they say they're united in the face of this U.S. threat. They're getting along quite well. There has been some progress on knocking down internal barriers, trade barriers. Ontario is now joining this new regulator that's going to make it easier for businesses to raise money on the capital markets. The financial paperwork done in any province will apply in every other province. But there is one area where the provinces are asking Ottawa to do more, where there is some disagreement, and that's on the Canada Health transfers. Provincial budgets are a sea of red ink right now. There are huge deficits. A lot of that is driven by increased healthcare spending. Have a listen to what some of the provincial finance ministers asked Champagne to do about that.
Person in the ER, the Canadians sitting in the long-term bed, that was the top. It was right down to the person needing the care today. That's where the discussion went. Minister Champagne heard our pressures, and we're looking to make some progress on that.
We did speak with the finance minister about the absolute essential need to increase health transfers. That's almost non-negotiable. We have to do it because our citizens expect that of us. Also grow the economy, invest in our people and our health care.
So increasing the Canada Health transfer non-negotiable for Ontario, for PEI. They're saying they're adding the pressure onto Champagne to do something about it. Of course, the Canada Health transfer has increased a lot in recent years, about 5% a year over the last 5 years or so. And it's actually due to increase by 5% each year between now and 2027, 2028. But then beyond that, it's an open question. I think that's why the provinces are raising it today. Is Mark Carney and his government willing to increase spending that much more when they're tightening their belt elsewhere, we heard Minister Champagne sort of dodge the question today, not address it directly as to whether that's one area they're going to be increasing spending, being tight-lipped about willing to renew that Trudeau-era commitment. We can tell from these clips today, we can tell from what we heard from the provinces that they want to make it abundantly clear that that's exactly what they expect. They want to see a lot more healthcare spending, something that's not really on the agenda here in Ottawa, but could be in the coming weeks. Andrew?
Certainly on the minds of the finance ministers. All right, JP, thank you. CBC's JP Tasker, live in Ottawa.